Hello everyone, I am Kaydia McKoy and I am a breast cancer survivor. This is my second episode of Let's Talk Breast Cancer, and today I have breast cancer fighter Ms Dawn Blair, who is fighting breast cancer for the second time around stage 4, and we will be hearing her story. I would like to thank The Right Prolific Outlet for this episode for their sponsorship to Ms Dawn Blair. Stay tuned.
Together we rise up high underneath the same.
So before we go into your story, Ms Dawn Blair, I want you to, tell us how you're feeling. How are you feeling today?
How am I feeling today? Not bad. A little pain here and there.
Right.
But what I find is like it's a moving pain, because sometimes it's the hip,
Right.
and sometimes it's like the rib here under the, so like
Right.
ongoing
It's not necessary.
pain, like that I necessarily have to go run for a painkiller and so on.
Right.
What it does is like sometimes when you have to lift the hand,
Oh, you have pain.
yeah, you'll
Okay.
feel it and so on.
But you're glad to be here, right?
I'm glad to be
Extremely
alive.
happy.
Wow.
Right.
I'm glad to be alive each day. Well, my mantra now is that, try to live one day at a time,
Right, so that's
So
true.
each day you are woke, it's just time to give thanks and to go on.
Right. And Miss Blair, so you're fighting the breast cancer twice.
Second time
around, right?
Yeah.
So I want you to tell us about your first diagnosis.
First diagnosis, I was 62 at the time. And in both of these instances, I found a lump, What happened? Before we reached a lump, I used to do my regular mammogram.
Right.
Not necessarily yearly, but like every other year or so. But I used to do my mammogram fairly regular. But what happened is like over time, they keep coming back, okay.
Right.
So I probably did the wrong thing in that I break for a while.
Oh, because it's fine, so.
Yeah.
So, I don't need to do anything.
So
right?
each time, I do it, it would keep come back saying normal, repeat next year, So I said, yeah.
Right.
So one day I was lying on my bed, just relaxing, and I put my hand across my chest, and as it went down, I felt the lump.
So,
So
when you
this
felt
was
the lump,
in the left breast.
Oh, in the left breast. So when you felt the lump, what ran through your mind? Like, what were you thinking of? Okay, so my hand, just barely, grazed past my chest, and I'm feeling
Just barely,
this
miss.
lump.
I jump up, and then I started to, say, is this a real lump? Is this real? And then I start to
Right.
sort of,
And what year you said this was?
2022.
Okay.
Yeah, 2022. So I just jump up off the bed, and then I start to feel, and then I said, yes, a lump is there. So I went by my clinic, that's Grantspen Health Center,
Right.
and I spoke to the doctor, and they examined me, and they said, yes, Miss Blair, a lump is there.
Right.
We're gonna recommend that you do a
A
mammogram.
mammogram. Okay.
So went and did the mammogram. But so by now it was not the mammogram that told me that a lump was there. I felt that lump
You felt
already,
the
so I
lump.
knew something was there.
Right.
But the thing now that I was hoping for was that we always hear that not all lumps are cancers.
That's right.
So, so that was my next, so I was
So
saying
you were optimistic
that
right?
this one will
Yeah.
not be
It would
cancer.
not be, right?
Hallelujah. So,
And how old were you at the time?
62.
62.
Yeah.
Yeah.
And then what happened now? I don't have health insurance.
Yeah, I can just imagine how that is.
I don't have health insurance.
Not having health insurance, and then cancer is expensive, it's
Yeah.
time sensitive,
Yeah.
and then now we have to
We
up
go into
to
the public.
public.
Yeah.
Right.
So, okay, so because when I was doing mammograms before outbreak, I used to do it at the Cancer Society.
Right.
So I decided to go back there because I was saying they would have a history of my
Of your right.
previous stuff.
scans, right?
So, but the thing about it, my dear, when I called to make the appointment for the mammogram, I got a long waiting time. They give me a long, probably 3-4 months.
What?
Yes, and there was a long waiting period.
Oh. I guess because maybe we were just coming out of COVID and all the backup with the appointments, probably.
Yeah. So and I was surprised, 'cause
But
I'm
I
thinking,
mean, having a lump, it should have been expedited, as priority because we don't know what this is.
yes,
Right? We don't know.
you know. So when they give me this long waiting period, I was kind of taken aback. But anyway, what I'm saying, that was like my only option because I did, cause I don't have we are taught to go pay at a private thing.
Right.
And what I was saying, the reason for me opting to go there in the first place is that they already have a history.
Right, so that's why you went back
so that's
there.
why I wanted to go there.
And usually doctors ask for the previous scans. Have you ever done any, just to compare the results?
Yes, so that was one of the other reasons why I chose to go there. So, and then the next thing, after I eventually went and got the mammogram done,
Right.
another long wait again for the result.
For the results, yes. I
Another-
can recall. Well, I didn't wait long for the results because, of course, I went to Woman's Place, so I got the results immediately. But I mean, again,
it took some months, and
months for the results.
yes, man.
Wow.
Yes, man. Well, it's like I'm not remembering it like exactly now,
right.
but it was a long time. And then again, can you imagine the anxiety and so on?
Yes.
So it even seems longer than it,
Right.
But then again, I kind of brush it aside because I was saying, no, man, it's not cancer. Because had it been cancer, they would have called me. They would call me. So I said, no, man,
Right.
it's not. But then, no, when they call me,
They always say no news is good news.
so
But
what happened now? I don't remember if it was they that called me or it was me that keep checking to see if it was ready. But anyway, when it was finally ready and I went and I got this thing saying suspicious. Something and they recommend that I do an ultrasound.
Suspicious lump, suspicious tumor.
If suspicious is like
And what they recommended?
ultrasound. Yeah.
Oh, so an ultrasound was not done when you did the mammogram?
No.
Because
At
usually
Cancer
they do
Society,
both
they
together. They don't do ultrasound.
No.
Okay.
No.
So you.
So when I haven't gotten the mammogram result,
Right.
and they are saying they see suspicious
Right.
lump, they recommend that I do ultrasound.
Right.
Yes. Well, they know the panic buttons.
So when this, so take me back to suspicious lump. How are you feeling? What about your children?
How was I feeling,
Yeah,
miss?
how you felt?
Probably I've lost all my feelings at that time. But all the panic button, the red lights go off and the whatever. So and then the nurse at the center, she probably see me looking days out or lost. So she said to me, miss, don't worry. We get a number of these, and after in time they come back as being
Negative, benign tumors.
Yes. So that was a little thing, but So now, I decided now that I'm going to go to a private place. Did they recommend? No. The lady at the office, she checked around and told me where was the most inexpensive,
cost-effective
place
to
to
go
get
and get the
there.
ultrasound done, and you went.
And I went
And you
and so
got
on.
it done. So how long? What was the time span? between waiting, because remember you were already waiting,
Yes. So at that point, for the ultrasound,
right, for the ultrasound, to get the ultrasound done, and then after the ultrasound to get the results.
no, that wasn't long because
wasn't
that
long.
was kind of private.
So it was expedited. It was
Yeah,
fast.
yeah.
for you
That part of it was but where all the panic lights went off again now is when the doctor that was doing the procedure,
right? The ultrasound.
the ultrasound,
Right.
yes. I keep looking at his face, so
Right, we tend to do that. I did the same.
yeah,
I
I
did
keep,
the same.
you know, what I'm saying. Well,
So you're
this is
looking
not,
at the face to see, like,
this is not
okay,
new
it's
to him.
nothing,
Yeah, you know,
you know,
yeah.
or if they're making any funny sounds, like,
Yeah.
you know,
Yeah.
that's what prompted me with my
Yes.
diagnosis when I did the ultrasound. I was looking at the
Yeah,
doctor,
so
and
you know,
yeah, it
so
was the same.
it's like he wasn't communicating with me, so
Right.
I was asking a few questions until sure they make sense or never make sense because you know. So, but he said, you're gonna have to do a biopsy, and I recommend that you do it quickly.
Quickly, right.
So on. So when he said that, I said, "Is it cancer, doctor?" He said, "Well, when we do the biopsy, we'll know. We'll find out."
But that was
Everything went to the roof at
went
that
through the
time.
roof at that time. So after you got the results now from the ultrasound, you did your
Went
biopsy.
to so I now went to KPH.
Oh, what was
No,
the experience?
I went back to the clinic with the results.
Right, from the
And-
ultrasound.
Yes, and then
And then
now
you were
they
sent to
gave me a
KPH.
referral to go
To
to
go
KPH.
to KPH. So
Yes.
when you went to KPH, I'm sure that, you know, the waiting time again was.
Yes, waiting time and so. But in any case, there was someone who recommended that I should go not just to the surgical department at KPH.
right.
They had shortly formed the breast clinic.
Oh, the breast clinic.
So yes,
Oh,
so
okay.
they were specifically dealing
with breast cancer.
Yes,
So
yes,
you would have been registered to the breast clinic,
Yes.
and then
yes.
after that surgery.
But I still have to, cause it's not a clinic. It's not a private. It's a clinic, so you have to get a time to come back to the clinic to be registered in the clinic, and you're given an appointment to come back probably a month or 2 months time,
Right.
and then procedure from there. They send you to do
To do
CT
the
scan,
CT scan to
bone
see if there is any
scan.
spread.
Yes.
So you did surgeries.
Yes, I did surgery there.
What surgery did you do?
But what happened? Having done the bone scan and the CT scan, when I took the results back to them at that time, I was surprised that they had scheduled me for surgery not long thereafter. I was surprised.
That's
I was taken
remarkable.
aback
Yeah.
at that specific
Right.
you know. So
So I want to know, like, you know, with all that going on, I know it's a whirlwind because, I mean, they always say no two experiences are alike, but we do share similar experiences, right? Because, you know, it's really like a whirlwind. Once you're being diagnosed, and then, you know, surgeries and all the treatment starts coming in now, and the doctor starts to tell you that, you know, this is the plan. So surgeries. But how was it for your family? Do you have children?
yes, I do, but we are not closely knitted family. I have two children. I have a son and a daughter, but they are more into their immediate family.
Oh, okay.
Yes, so we have a strained relationship.
Oh, you have a strained relationship.
Yeah.
Okay.
Man.
So when you went in for surgeries, right? What was your support like? Was anyone there to take care of you?
Yes. I have a cousin, my auntie's child.
Right.
She just stepped in, and she was a support. She was a support for me, because at that point I didn't know of the Cancer Society group.
Right, Jamaica reached the
Yes, I didn't. Yes, so my cousin, she would follow me when I need to get the test done, and doctor's visit and all that,
and your labs.
Yes, and even when I was to be admitted, she came with me, and then she was my main visitor, and so on.
So what surgeries you did? Did you do like a mastectomy, lumpectomy? What did they do? Did they remove the entire breast, or
no? They did not. At the time, they had recommended that I just need to take the lump out because of where it was located and the size and so on, because it was sitting like on top
of the chest,
the breast chest
right
wall.
Here,
right here. So yeah. So though it is breast tissue, you know, but it's not like actually it was sitting right here.
Oh, so what you did was a lumpectomy.
Yes,
so you did not do a mastectomy where you removed all the tissues.
No. So they took the lump out and took some lymph nodes.
Oh, the lymph nodes. So so when you got back the results from the surgeries, did you have any spread to the lymph nodes? Any cancer in the lymph nodes?
Yes.
Yes, you did.
What the doctor said to me is that they are not going to recommend that I do chemo, but they recommend that I do radiation, because the here they said they got everything, it was clear, whatever, but when they remove whatever lymph nodes from so after surgery they recommended that I'd have to do some radiation.
Right.
And this was to be done not at KPH, but at St. Joseph's.
Oh, St. Joseph's, that's where I did my radiation as well.
They sent me to St. Joseph's to do that. But
so you did not do chemo?
No, they had said just radiation would be fine.
Oh.
But then this took a while to be done because
did they say what stage it was? Because I'm curious as to why you did not do chemotherapy.
No, I don't remember what stage it was, but it was probably like 2.
Stage 2? No, and you had spread to the lymph nodes, but no chemotherapy? Well, I mean, I'm not a doctor, and I don't know the reason, but it's just strange to me that you did not do chemotherapy.
They were the one that I was following their
orders, right? But because I'm not a doctor, as I say, but this prognosis would seem as if that you would need chemotherapy, which is why you're dealing with a recurrence now. Because what chemo does, is eliminate a recurrence as well, right? It's precaution, even if there's and you said you had spread to the lymph nodes, right? Which it's very strange that you did not get chemo. Now you're dealing with a spread. I mean, with a recurrence and also a spread.
Yes.
And so after radiation, you were cleared, right? Were you cleared? Were you on any medication? So what I need to ask as well, do you know what type of breast cancer?
It was hormone.
Like estrogen positive?
Yes.
Estrogen.
Yeah.
So were you on any medication after radiation? Like tamoxifen? Anastrozole?
Yes.
Oh, I am also on that as well. And you're still on it?
The doctor took me off because I'm now on some other medication, and they said that one is a similar.
Oh, similar to anastrozole.
Yes.
So what I want to know is, so after radiation, you have been taking the maintenance pills, right?
And still attending the clinic by KPH.
Oh, you were still attending the clinic. So when you go to the clinic, what they do? Just a regular checkup? What happened?
But still, when you say they just come out of COVID and probably panic and stuff, because when I go for my regular visit, they'll just take my file out, look at me, how you doing today, Ms. Blair? And so they didn't really examine me, they didn't really, I don't remember.
Oh, they don't check.
They didn't examine me. So probably
they just take a file out.
Had they done that, probably they would have picked up that something was going on here.
Okay, so I want to know now. So you have before the second diagnosis, you just have been going to the clinic, taking your medication every day. And what happened? How did you found out about the second lump? And is it in the same breast or the other breast?
No, it's not. It's no longer in the left breast. It is now in the right breast. It's now in the right.
When this came back last year?
Yes.
Last year.
Yes.
So after 2022, so 2023, 2024, it came back. And do you remember what time in 2024?
I think it's around November, December.
November, December. No, it wouldn't be. Because November, December 2024 would have been a couple months ago. And I remember when
23.
23.
Yes.
So it's 2023 that it came back in November, December, thereabout. So what happened again? How you discovered this lump?
Oh, I discovered this one. I was having a shower one morning to go to work, and while showering, my hand just hit up on this one.
Wow, what did it feel like though? Was it like a marble? Was it big when you felt it?
It was bigger than marble, miss.
What?
Yes,
and that was the first time you were feeling it?
It was the first time I was
feeling it? So it's like this thing just popped out of nowhere?
It was the first time I was feeling, because I was, like persons who I talk to, I'll say, but it's not the first time I bathe. Since then, I bathe every morning to go to, So, but for whatever reason, this particular morning, while showering, my hand just happened to hit up on this thing. So by this time now, I had made some acquaintances, doctors and so at St. Joseph's. They were very nice.
Yeah, they're very nice at St. Joseph's.
Big
up to St. Joseph's.
Yes, St. Joseph's, yeah, man. They are very nice. They are very warm, friendly, and so. And because not really probably like a big place like KPH, like so KPH, the morgue. So I went down to the doctor there and said, Miss Lump.
To the doctor at
St. Joseph.
St. Joseph, right.
So I told her, and her name's that Cuban, and she's
Dr. Morales?
She's no longer in Jamaica.
Yeah, she's no longer
went
here.
back to her time.
She's nice.
She's very nice. She's very nice. So when I went to her, I think I called her. I called the secretary, and then they spoke to her and said to come in.
Okay.
And then I went and showed it to her, and she examined me and said yes. And right away, she got on the phone to Dr. Copeland. And said, your patient, Dawn Blair, we're going to send her down to you because whatever. And I said, okay, send her down.
Right.
And then she got on the phone to Dr. Copeland, and then I've been explained to him. He said, okay, send her down.
Right.
But breast clinic at KPH is only kept on a Tuesday. So I'd have to go.
So you had to wait
the next Tuesday to go down. Okay. So as soon as Tuesday came, I was present. And when I went there, because she gave me a letter to take to him. So I just took it straight to him. And then he examined me and said, confirm as well that yes, a lump is there. It's not in my head, it's real.
It's real. So how did you feel at this time? Because for me, I don't think I can deal with a recurrence. Like, it would be a total nightmare if I should, God forbid, if I should feel a lump. It would be heartbreaking for me, for my family, my friends, my daughter. I don't know. I mean, we are strong, right? But I don't know if I could cope with that. Like, how did you process it?
Okay. How did I process that one? Because to be honest, that I was happy to get a second time around.
Right.
But having spoken to the doctor and so on and examined me and so, and it's like what he said, you can draw, and I asked them questions.
Right.
Even though it might not necessarily be the right questions, but
at least you still
yes,
ask.
and because what happened, I tried to feel, and okay, once they are not panicky,
right,
or they're facial expression or so is not like, you know,
Then you say, okay,
where
it's not that
yeah,
serious.
it's sort
So
of,
it sort of cushion you a little.
yes, yes.
But what I want to know is that, you know,
so I
dealing
was
with a
telling you
second
about the second time
recurrence.
around. Okay. So, having gone to Dr. Copeland, you know, he's the head of the breast clinic.
Right.
So, and as a matter of fact, he was the one that did the biopsy this time around.
Okay.
So, we're talking about right breast now.
The right breast, right. Second breast, yeah.
Okay. So, having examined me, he sent me up my IRAD to buy, to purchase
Oh, yeah, that's sweet, yeah.
to purchase the biopsy
the
needle.
biopsy needles, yeah.
And even that was a drama, you know.
What?
Even that
How
was
is that so?
that was a drama. When I went for the biopsy needle and I got it, took it home. When I took it to the doctor, and they said the gun, it wasn't firing, like something was wrong with it.
Oh.
And then the doctor said to take it back to them and whatever. So it was a manufacturer.
Oh, it was a manufacturer's
Yeah,
default.
yeah.
Okay.
The people them say no, they don't know what I do to it, so and they can't refund the money and they can't give me a new one.
I had a
whatever.
similar
So,
problem.
When I
with
told Doctor I was
support.
mad, I said no, it is a manufacturer. He called them and spoke with them and so on, and
they
then
changed it.
yeah, they called me. It's a good thing I had my phone on me, because by the time I left KPH and went down to Paris, because I don't drive, I take the public
So
transport.
can you imagine not having insurance?
So,
You don't have any money. You purchase this
Yes.
needle.
and then,
And then
I
there is a
can't take it
problem
home
with the
for
needle.
souvenir.
Exactly.
So what I go to do to
So what-
take it home to
and
buy a
then
new
you
one.
would have to buy a new one, right?
No,
And I'm
so-
sure the needle is expensive because
Boy,
everything
this-
that has to do with cancer is expensive.
So,
Every
boy,
single thing is
these
expensive.
kind of journeys, sister dear, it's so you
Right.
here you are, you're trying to cope, but then when you come at these snags in the road, it just not helping. But anyway,
I can totally relate.
so having passed that hurdle now, I took it back, get the biopsy done and so on. So I said, Dr. Copeland, theater again? And he said, yes.
So this time, what was it? A lumpectomy?
No, nothing not do up to today, dear.
Oh, hold on. So nothing is done up to that time?
No.
Since that time?
No, so hold on. Okay. When I did the biopsy answer, so I had said things, so before I got the result back, so I said,
Right.
Doctor, theater again? And he said, yes, Miss Blair, same procedure. So, and then he sent me to do the bone scan again, and the, you know, kind of say same procedure, so the bone scan again, and CT scan, and
Right.
whatever. So, because the first time around that I told you, when
Right.
I brought these results in, the date was set for theater.
Right.
And then I went to theater soon thereafter. And since he had said same procedure, in my head, I packed my bag
But
already.
because your first
Yeah.
diagnosis, it was expedited because you
Yeah.
said that, you know, you couldn't believe how
Yes,
fast the surgery
yes.
was done. You got to
So
for surgery.
I was now in
Right.
theater mode. So when
And
I,
this was 2023,
yes,
December.
yes.
Right.
So probably I got the biopsy result back probably like in January, because it was closer to
Right.
Christmas.
To
Closer
Christmas.
So probably say January. When I went to the doctor, miss, and they told me, Miss Blair, sorry to let you know, this one is also cancer. And then he
How were
said,
you feeling at that time?
I wasn't feeling bad.
I guess
Yeah, cause like I was kind of more mentally
prepared.
Yes,
yeah,
because
you were mentally prepared.
yes, and what happened? The fact that probably what Dr. Copeland had said to me, say same procedure.
Yeah,
So
well,
it's like
yeah, so she's
I was
saying it
more
then, yeah.
focused now on theater.
And theater, just
Yeah.
getting this thing done.
So
Just like the first procedure.
yes. So
yeah.
what I was thinking of, because having told me what the result was, the doctor, what the result was, he said to me, so Miss Blair, what are you going to do now? So I said, doctor, what I go to the doctor? Take off the titty. Take it off, doctor. Doctor, take it off. So he said, but Miss Blair, you didn't do that the first time you did, you know, the lot. So I said, doctor, because that time I never know what, so but this time around, take it off, doctor. It's all right. I take it off, take it off. So he said to me, anyway, it's like they can't honor my wishes right
They
now.
couldn't honor your wishes, right?
Yes, because I know breast clinic,
Right.
long line.
Oh wow.
You know, there are others ahead of you and probably more serious whatever story. So you're gonna have to probably join the line and wait there. Yeah. And then again, with that now, sometime when you get your clinic appointment and you go to clinic, your docket can't be found. And if the docket is not found, then the doctor can't see you because they need to see the docket to see what we have done so far and what is going forward. So sometimes
So when they can't find your docket, right?
you get a new appointment for another month.
And then when you go back
sometimes there is no guarantee that it is found. I don't know why KPH have to last the dockets so frequent. A number of person there would tell you that for whatever reason they claim the docket can't be found. I don't know which cupboard or cabinet they put it in. So that delay.
So that delay, and remember, as we said before, cancer is time sensitive.
Yeah. So, my dear, with this now, during all of that and so on, I just have to wait. Although I know, say, waiting is not the best thing to do with cancer. But it's like I don't have any alternative, no option.
Right, because you don't have insurance.
I don't have health insurance. I don't have the wherewithal
to go private.
And then again, too, I had lost my job in COVID.
Oh wow.
I'd lost my job in COVID.
Right.
I was now just doing a few days work.
Okay.
So my income
is not sustain all of
what
that
it
at all.
used
Plus
to be.
Bills
And
bills,
then with
food,
me
and then diet change.
ill and aging.
Right, ill and aging, and also your diet change. And I mean, to have a good diet, I mean, it's quite costly. Yeah, because as survivors and fighters,
and not to mention the tests and the things, because
the scans,
some of them you have to pay. At the KPH you get a few things that you don't. You go to patients affair and they will whatever. But it's not everything. There are something that you have to go out there and go pay for it. And although,
especially to expedite the process, right?
And although I try to be the smart one when I go, I always try to be the smart one, you know. As I say, it's not really keeping a pity party, but I always ask them, so anything for the senior citizens?
But of course, it's not a pity party. You know, you want to get through. You want to get this done with. And I mean, and the wait.
Yes,
and you have to be there from early.
I'm always up. But you see me now, my kind of attitude, you know. If I think I need to ask a question, I'm going to ask, you know, is it a yes or is no?
That's right.
So,
that's right.
Anyway. Man, these tests and so there was a blood test that I did since I'm going to the. So after the CT, they recommended that I do a PET scan, which my dear,
the PET scan came
whole heap of money.
Yeah, it's like PET scan is what 350,000. Yeah, 350. Yeah, about that.
Yeah. And so it's a lot of waiting.
So how did you cope with finding all this funding not working, just doing a day's work? Did you get any funding from the government, like Chase or you have Chase Fund, you have Ministry of Health, anything from those?
When I expected the doctor that, sir, I don't have any health insurance, whatever. They tell me to go and apply for a compassion grant.
Compassion grant from the Ministry of Health, I think. I believe, yeah.
Miss, I went up there and I fill out whatever form and the thing, and they tell me It will take, it was 3 to 4 months. It was a good while. But miss, up to today, I don't get it. Because each time I have to go to KPH, I went and asked if it is ready now. No, miss, so...
Right.
So these things that either don't exist or they, I don't know.
You don't know, yeah.
So if I was waiting on that, so what happened? Because I'm now with the cancer, the Reach to Recovery.
Right, Jamaica Reach to Recovery.
Yes.
Right.
So I heard that they have some help.
Right.
So
where you
I went in.
You went in and you got help.
Yeah.
So you get 100,000.
100,000,
right.
you know.
That's a really good thing though with
yes,
the Jamaica Reach to Recovery.
So I'm thankful for that.
Yeah, I got
And
assistance from them too with chemotherapy.
Mm-hmm.
They paid for one of my treatments, which was quite costly.
Yeah. But so you know, thankful to them for it, and so and I really do appreciate. But as I said, this is now $350,000,
Right.
and 100,000. Though it is helpful, and so that is not even half of what you need to come up with. My church as well put some funds together. I don't remember now how much they had given me, but my church had like collected some offering or so and helped me to but then
But you have been blessed.
I have to find the rest from my savings.
You have been blessed though, Ms Blair, you know?
Yeah, man. And
to
I'm
see
thankful.
that you're really on this journey alone and you can still navigate care and get your labs and your scans on, you know, quite resourceful. You know, it tells a lot about the type of person that you are.
Yes, yes.
And I remember the first time when we had a conversation and you said to me that, you know, you have been going through this recurrence for over a year and you are waiting on surgeries. And you up to today, this date here, you are still waiting on surgeries. So I'm sure you're dealing with a spread. And at the time when you said it to me, Miss Blair, I cried. It brought me down into tears. It really did.
And you know, since then, and even learning about the spread,
right?
I don't think I've cried, literally cried. I know cancer is serious and it's you know, it's terminal, it can be terminal,
right,
and so on. But I think this is where my faith in God kicks in.
Right.
And my church family have been supportive in that sense. Where they encourage me of their prayers and they, you know, give me a hug, an encouraging word here and there. They say, "Oh, Ms. Dawn, you're looking good today." You know, so those kind of little things, kind of, you know, yeah.
So what's next for you now? You're just
I went to the doctor. I went to the doctor. I am now up by Hope Institute. I was sent there from KPH to do chemo therapy because at this point now they were saying
chemo is
to
needed.
do chemo.
So you still have the lump in your breast, right?
Miss, it is still there. To me,
has it grown? Is it still the
to
same?
me, I think it is shrink. To me, I feel like it's shrinking a little.
Like it's shrinking.
A little.
That is good.
Yeah, I feel that way, but I don't know if when I do the, because I'm supposed to do a CT scan soon to do the measurement and to see exactly what is happening. But the thing about it now, when I went to Hope to do the chemo, because that's what KPH sent me there to do.
Right.
And this was probably June.
Right.
Between June and July. I'm not remembering dates so well, but because I think I did the PET scan in April. So after I took the results back to KPH and then they sent me up to Hope to get the chemo done.
Right.
So when I went up to Hope now, the doctor, he now was looking puzzled because I said, Ms. Blair, how old are you, Ms. Blair? I said, wow, you're still young. And, you know,
and you're waiting.
And the diagnosis this far and so on. But then what he said is that they have this medication, this
Right.
therapy.
Trial.
Yeah, I
Yeah,
have it. You know, I have it
trial
with me. But I
Okay.
don't. Kisqali,
Yeah,
and
I'm not aware of that
and
one.
and there's the next one. So they said they are gonna try to get me enrolled in that program. I think it's in the USAR. It's some abroad country.
Okay.
So I'd have to apply for like acceptance. When you send the procedure, the stuff to them,
Oh, okay.
they
So
will,
you did that already?
yeah, man, they will vet it and so on. They said normally this take about a month.
Everything is wait. Everything is wait.
This will take about a month
Oh
to be
my.
processed, but it took more than a month. It took about probably 2 months. 'Cause each time I keep calling, is it ready yet? Is it ready yet? They said, not really.
I like how you're just advocating for yourself and you're not just sitting down and not doing anything about
Yeah,
it. Something
man,
has to be done.
I keep calling them.
Yeah.
As a matter of fact, I don't even call them. I present myself up there.
Of course, of course.
Sometimes I present myself up there. I said, because even at one point they were saying, Miss Dawn, because they know me, you know. They know me. Because even one of the doctors said, oh, Miss Blair. So I was even saying, doctor, you know me?
You know my name, right?
Yeah, because this is a public place with a lot of patients and so on. So I said,
And for you to
I
like
didn't
stand out like
expect-
that for
yes.
the doctor to
You know,
know
so
your
I
name.
said, doctor, you know what my name? And he said, yes, man. You know, there are some persons who, you know, like they just hit a spot.
Right.
You don't forget them that
You don't
easily.
forget them, right? That's true.
So, you know, so no.
So you left an impression on the doctor. So he remembers you, right? Yeah.
I try to be nice. And you know, in Jamaica, we say, boy, who have raw meat have to seek fire.
Uh-huh.
So, you know, I try to, you know.
You try. Whatever you're going through,
Yes.
you still try to put out the best.
Yes.
And
you know.
I mean, it's not easy, you know. People see us and they think that we're happy and
Can I tell you, at
I
one
mean,
point,
they don't know. We try to be strong and we try to maintain a positive attitude. But with the positive attitude that you have, Ms. Dawn, trust me, I am positive that you are going to beat this again. You will. Just continue to remain positive. You know, that positive energy.
yes, I'm trying. But the
Right.
thing about it now, probably 5 months ago or so,
Right.
my appetite went through the window.
What?
Yes, I just wasn't eating. And what I think was, as man was saying, Dawn, something is affecting your mind. And what I think that is you're not sure if you're going or coming. You're getting dates and deadline. Okay, this will take a month. And then a month turn to 2 months. Well, not quite 3 months, but a month turn into, and then even going into 2 months, there is still no guarantee to say in another 2 weeks Miss Dawn will be ready for
And
you.
because of how the public system is
Yes.
and the runaround that you have been
Yes,
getting.
man. And
You know,
outside
it's like
of
you're
that,
unsure of what's, you know, so much uncertainty.
yes, man,
Yeah, what do you
it
do?
affects you mentally.
Yeah,
And then
what do
again
you
too,
do?
with all these persons who have never had cancer, and they say, Miss Dawn, you're not to eat this, you know, and you're not to drink that, and you is to take this bush. And so you are bombarded with all these things.
That's true,
It
yeah,
mess
yeah.
up your mind.
Yeah, that's so true.
And then again, being alone,
Yeah, and especially that you
you
mentioned
don't
earlier that you're alone now.
really
Yeah,
have anybody to.
and I know where you're getting at, because being alone and everyone is telling you this, and then you're dealing with, you know, all these mental
it's
issues
like you
going
get
on medically,
confused.
and you get confused and you don't know what to do, right? But you know, and this is where support comes in. This is where support comes in, because you really have to talk to those who have been on the journey, you know, who have, you know, experienced
That's why
And
I am happy for the
group
group at Webster.
at Webster, right?
Yeah, you know, and
which is the Jamaica Reach to Recovery, guys.
to recovery.
Yeah.
Yes, and the thing about it, as I heard it somewhere, is that to be careful, because some of these persons who have never had cancer, just what they see on YouTube or here or so on. Because right now, there's a next person who we know at church.
Right.
She's not in Jamaica, she's away. I think she's in Bahamas or something like that. But she has serious cancer, and I'm not sure if it is colon.
Right.
But it's like my neighbors are using her prognosis or thing to,
No.
yes, cause
And that's where
what they
they're
are saying.
That's what they're.
Miss Dawn,
Yeah.
what stage is it? If it's in your liver, you know, whatever. They're not doctor. They're
No.
not.
So that's where you have to draw the
times
line and
they
lock out.
tend
Yeah.
to try to get information from you, but it is not in a way to help you or to encourage you.
It's to compare the situation to see if Miss Dawn is going to make it or not, or what going to happen to Miss Dawn. But no, you need positive people around you. Yeah, you need people that will motivate you, you know.
It's out there.
Yeah, you need people to motivate you.
So all of that.
And then
now,
sometimes you have to just condition your mind and say that, you know, you're going to have these, it's coming at you, because some people are not that, they don't understand the sensitivity of cancer, right? And especially when you're dealing with a recurrence and a spread, because you have a spread, right?
Yes.
And because there are some lumps in your,
And
I
what
can
they're saying
see
is that
that
I'm at stage 4.
you're at stage 4.
Stage 4.
Wow, because there you have some lumps, some small tumors in your
I
neck.
can think of about 4. There's 2, one on the left one, and then there is 2 again right here.
Right there. Wow. So do you think that the chemo is it's helping?
It's helping.
Yeah.
Yes, as I said, this here
It feels
to me
like it's
to me it feels like it's a bit smaller.
Okay.
So, and the doctor, when he felt these, you're saying yes, he's thinking that, you know, they seem smaller.
I think so too, because when I felt it few months back, it was hard, and looking at it now, it's not looking so much pronounced.
Yeah. So and what happened with these tablets that I'm on now? The doctor said she's gonna try me with them for 6 months.
Right.
I've gone 3 months already,
Okay.
and I'm hoping to get the 4th month. So,
Right.
but even that's a problem too, you know, sister. Yes, that's a problem too, because I should have gotten this one from Friday, and they say this stock is not in.
Oh, stock is not in.
Because the person who correspond with me and so on, she told me the other day that Ms Dawn, the shipment came in last Friday,
Okay.
so you should
But
get it
not-
soon.
so you should
So,
get it
you know, but actually it should
So
have been a
is
continuous
it
thing.
there? Yeah, it should be, especially
Yes.
when you're dealing with a life-threatening disease.
Yes.
How?
Because there are times when they said, so I said, Miss, what is going on?
Yeah.
So I said, sometimes the government, the persons in the ministry,
We'll
don't.
have to follow up and have these medication
No.
in stock all the
Yes.
time.
So-
I cannot do without my anastrozole. If I miss one night, I feel like it's going to come back tomorrow. So if I miss my pill tonight, the mental part of it for me is the cancer is going to come back tomorrow. You know what I mean? And so they have to have these
No, my
in
dear,
stock all the time. You know?
So when so the thing is, though, you are dealing with a lot of people and so on, and you know, I think it's God helping me along as
That's
well
right.
with favor, because the lady at up by UE, where I pick up the medication, as I was saying, why they just giving me 1 month supply all the time? It's just
They
1
should
month
just,
supply.
they just give you, at least 2 months.
Yeah, you know.
Because each time you have to go up to you. So
And sometimes you go there, it's not ready.
It's
You know,
not
you have to
ready.
still wait like a day or 2 before it's ready. That's kind of a thing.
yeah.
That kind of a, and then it's a very expensive drug. So like say you go and take the prescription and go buy it out the road, because I think I hear
So do you have
it
NHS?
is like
Do you have NHS?
800,000 per month for it,
Yeah.
something like. It's very expensive.
Wow.
So you see, I can hardly pronounce it much more
Right.
to, you know. And as I was saying,
800,000 monthly.
for it, and you can imagine I'm supposed to be on it for 6 months.
Wow.
It's a lot of money.
Well, thank goodness there's still
Yes.
some good coming out of the public health system, right?
Yes.
Because at least you're able to get the
I'm still-
medication.
so, you
yeah.
know, because even that lady abroad, she's Jacqueline, her name is a funny name. She texted me to tell me that my thing was approved and so on and so forth. And she said that from time to time, because she's on my WhatsApp, any questions and so I can, you know. So
Okay.
whenever I go up there and don't get to say, Mrs. Jacqueline, I don't get no medication, what is going on? You know, so she texted me back and to say that, Ms Dawn, the shipment came in, you know, but you know, they will strip it, clear it, whatever.
So with the medication, what are the side effects?
You know, I don't think I have any.
No side effects.
No.
So you won't lose your hair or
I'm not supposing. As a matter of fact, I got my hair come the other day and somebody said, Miss Dawn, your hair grow.
oh,
And then I was saying, wrong time now for hair growing, you know.
you will be fine. I love your spirit, Miss Dawn.
So,
you know, as a young person, you know, because I can say that I'm still on the journey because I'm still on medication and I'm still doing bone treatment. And with your spirit, I feel so motivated. And this is what we're here for, to motivate each other.
I try. And I appreciate you as
Thank
well.
you so
know,
much.
I know, with you being, you know, and
Thank you
striving
so
and achieving. Yes, I respect and appreciate you too.
Yes, my
you know.
advocacy will continue as long as I'm here. I will forever be grateful to support my sisters and support our women. And you know, a lot of young women are being diagnosed
That's
as
what
well.
I realized, because it's like each time you go to the breast clinic, it's a group of, you know, and some of these young girls don't even have any children as yet.
And you know, so my advocacy will continue because my aim is to save lives. And I just want to get the story out there that cancer is not a joke, and early detection saves lives. You know, it is the key to survive. Right, Miss Dawn?
Yes, it is.
Listen, I don't even work with any insurance company, but make sure that you have insurance. Insurance is very important, whether it be critical or just something within the workplace. It is very important.
Yes, so as you were
because
saying
it cushion you,
you were saying that,
at least it will speed the process of going into the public system where you have to wait. Miss Dawn is still waiting,
and
many others are waiting, and you know, dealing with recurrence and with spread. And but my thing though, Miss Dawn, and I just don't understand, you know, from the beginning, why weren't you given chemotherapy? You know, especially that you had spread to the lymph nodes, and that doesn't sit well with me at all. I've been thinking about it sitting here, and I would love to know why weren't you given chemotherapy? Because maybe you wouldn't have, you know, the recurrence would, you probably would not be going through this right now, which is, you know, I'm still puzzled as to why. And I wish you, you know, I want you to ask your doctor why weren't you given chemotherapy from the first diagnosis.
Well, then again, I don't even know if these such doctors know if they would be able to answer that. Because I said I'm not really at the breast clinic.
Based on your reports, because I'm sure wherever you go, the reports are being sent there. They can look and maybe come to some sort of conclusion as to why.
Because the last time
I mean, it won't help, but at least, you know, you can say to someone, make sure that if there is a spread under your lymph node, advocate for chemotherapy, make sure that you're getting the treatments done. And that is why when you're being diagnosed, I think women should find a support group so that we can share our stories and, you know, probably get some guidance as to what, because trust me, these doctors are busy. They don't even have time for you sometimes.
That's true.
They're dealing with, they're caring for so many patients. and they're not going to single out one person and say, all right, you know, take the time out to. They don't listen. They don't.
But as I was saying, I try to ask questions, but as I'm saying, sometimes I'm not even sure if I'm asking the right questions,
right.
you know. But although my doctor now up by there, Dr. Grant, you know, talking with him and saying, say, Ms Dawn, I like you, you know, because you ask questions and you want to know what is going on.
That's it, because I ask some ladies and I say, you know, what's your prognosis? They don't know. What type of breast cancer? They don't know. Are you doing chemotherapy? They're getting chemo and they'll still tell you that they don't know. But Ms Dawn, you have information here. You know about your diagnosis. You know what type of breast cancer that you have. And so that's really commendable of you, you know, to have all that information.
But the last time I went to the doctor of Hope Institute, it was last Friday, I asked the doctor, I said, doctor, what next? Where do we go from here? Are we going to theater? Are we? And he said, no, Miss Blair, back up, we're going too fast. And then he's like, kind of walk me through. So what he was saying to me is that, no, Miss Blair, you're not going to go to theater for right now. Because what they say they want to do, because there is spread,
right,
to the lungs.
Oh, it's spread to the lungs, okay.
They want to, and that is why they're going to do a CT scan soon,
right,
to see exactly what is happening and the measurements and so on. So they have to first see the effect, like the shrinkage and what is really happening. So, but he said no theater right now.
No theater.
So this treatment is and to be honest, I have this friend who's a retired pharmacist, and she even said to me, Miss Dawn, you're on a very good medication, you know. It's so, and I asked the doctor as well, and he said, you know, Miss Dawn, because I was saying to him, so doctor, I'm gonna be doing chemo after this, and he said to me, to be honest, now in these modern times, this tablet is like a form of chemo.
Oh.
Yeah, so he said that to me.
Okay, so things are changing.
Yeah, so it's not just, you know,
it's not just
intravenous.
Yeah, right.
So that's so, but up until this point, I didn't know that because I was still, you know, bracing myself and saying when the chemo going to start.
Oh, okay.
But then again, no, this is why it need to be continuous. This break thing.
Yeah, the break not going to work.
Yeah, this break thing not so.
Yeah, they need to have adequate supply.
Yes.
Yeah.
Yesterday, I called the lady up by Yui to say, we don't really have it in house as yet, but we soon get it. So I'm not sure how many days, names.
How long you have to wait?
But
wow,
this is it. When this is happening, I have no other option but to wait, because you know.
So what's next for you? Just to wait.
I can't tell them to alright, give me the prescription, because it's almost a week now that I'm out. So you know.
Right.
But what the doctor was saying, there was this next, because I get two tablets, two sets of tablets. The Kisqali, which is probably I got 3 of those tablets, and then I got another 1 tablet that I take. 1 every day.
Okay.
So that is he said that small one. I don't have the name on me now, but it's in my background.
Right.
I'm gonna try to show you now. But
right.
I forget to take it up here. He said that small one it works in a similar way. I think someone says a little stronger than the anastrozole.
And the tamoxifen.
Than the anastrozole.
Well, I need to ask my doctor about that.
Yeah.
Because I want the strongest medication. Anything to prevent a recurrence.
So
I am going to ask about it.
So that was why now they tell me not to take that one again, because I'll be doubling up.
Oh,
so
right,
I'm to break on that one and just concentrate on taking this one now. So that's what I'm doing. So when I told him that the medication is not available right now, so what is, and I had I think I still have one dosage left to be taken tomorrow. So what he said is that when that is finished tomorrow, I'm to go back on the anastrozole.
Right.
instead of being out completely, at least that will.
Oh, so you still
yeah.
take the anastrozole.
Yeah, until
that makes sense.
yes.
Right.
So
instead of not taking
anything at all.
That's true.
That's what he said to me.
Yeah.
But I'm praying that it really comes before the end of the week. Because what I said, I called her yesterday and she said so I might very well be calling her tomorrow. So
that's right. That's right. You have to advocate for yourself. Yeah.
So this is where I'm at.
So you're just waiting.
Yes.
And you're at stage 4.
Yeah.
Stage 4 and waiting. Yeah. Wow.
So it's just like there are a number of persons, as I said, my church setting is, apart from you, the recovery group is, so at times when they'll ask me, so Ms Dawn, what stage? After time I don't tell them.
No.
Or I'm selective as to who I tell.
As to who you tell, because once you mention stage 4, then you know what they're going to
start
say.
by a casket. And
and you really don't want that, right?
Yeah,
you're in good spirit, and we're keeping it that way. Yes, we're keeping it that way. We don't want that. You don't. We don't.
I'm going on one day at a time. So no, I a part of the preparation to be taking this tablet.
Right.
As I said, this is a similar form of chemo.
Right.
I had to do some denture, some work, some dental.
Oh, so you're doing the bone treatment as well?
Not as yet. I have the prescription to take back to them.
That's zoltronic acid.
Yes.
Yes, I am doing that treatment
they
as well.
said that the dentist had to give me the okay to because it can affect.
Yeah, it can affect your jawline or
So
the jawbones.
I took the result, the report from the dentist.
Okay.
To them last week.
Okay. So do you have a spread to the bones, or why did they opt for the bone?
I think so.
Yeah.
But apart from that, my pharmacist friend there told me that because I'm on the hormone thing for a while,
right, that
in itself tend to affect your bone.
Right, which is one of the reasons why I am also on bone treatments. Because of the anastrozole and all the previous treatments, so I'm at risk for scoliosis and other bone diseases.
Yeah, so that's what. So the doctor really had said to me that they don't want to prevent the bones from breaking,
right?
Because they can. So I said I can't afford no fall right now.
That's true.
So but then what happened? When he wrote the prescription for me, he gave it to me to buy and then to take it with me when I'm coming back at the end of the month. So I was saying, so do I buy it, doctor? Because I didn't know what it was. I thought it was a tablet. So I said, do I start taking them or do I just? I said, no. You have to take it to us. It's a IV.
Oh, it's IV.
So when he said that to me, I said, yes, doctor.
That's funny.
I thought it was tablet. I said, no, we have to administer that one to you. So when you come in, you bring it. So he was saying, yes, I can get that one at JugServe. I don't necessarily have to pay for it, so I'm hoping that it is in stock. So
I want to know though, because you said you have not cried since the recurrence, right? So what's your weakest moment? I mean,
when I was told, when I did that first ultrasound and that perplex doctor, when I left the area that I was off the bed where I did the ultrasound, it's a good thing the bathroom was not far away. Miss, I didn't know there was so much inside of me. I think I had to flush the lube about 2 or 3 times because it's like it all.
And this was with the first or the second?
The first, yeah.
Because you were strong enough to handle the second one. The everything is just like it just. So what is keeping you
And I
going
think-
now, Miss Blair?
I think,
'Cause for
I
me,
think I
my-
cried then at
You
the end, in
cried.
that first, yeah.
What is keeping you going? Because for me, my daughter and my husband and my family and my friends, my support system, they're the ones who are keeping me, going. I try to maintain a positive attitude for them. And so who is motivating you? I know you said the church, but within your inner self.
And when I said,
because you have to have that inner strength too.
when I said the church, it's a big,
Right.
it's a big congregation.
Right.
But it's like there is a group within,
a group within the church.
Yes, man. That
Okay, but
come alongside you.
But when it comes down to your inner self, your inner strength, what is pushing you to hold on? Like what is saying, Ms Dawn, hold on, everything is going to be okay. Fight.
I
Just the will to survive.
get up and go.
Just the will to survive.
Yes.
I like that.
I-
And I know
I-
you're going on your hotel trip,
Yes,
and you're
man.
looking forward.
So these things,
That's in May.
and the next thing in addition to that, when I keep saying, should I live until March the 17th will be my birthday,
Aw.
and persons keep saying, Miss Dawn,
Miss
don't
Dawn,
worry yourself.
yes,
you
yes,
know.
yes, you're
And
going to
at
make
this
it.
point, I'll be 65.
Oh man, we'll have to throw you a party.
So
Yes.
these things that
That's
keep-
March 17th, right?
17th
I
of
will
March.
remember.
Yeah, so you can imagine too. Okay, after I was diagnosed in 2022, I think it was
Right.
May or thereabout. It's like I didn't know that I would still be here today.
Look at that.
Yeah.
Look at that.
Because even as a matter of fact, even when I went up to Hope, and here I'm at stage 4, and so I wasn't sure I'll be here for Christmas.
For Christmas, look at that.
Or even for New Year.
Mm-mm.
But the fact that I'm still here, I'm just saying,
So you're grateful.
Miss Dawn, tell you what, don't bungle it up, just live one day,
A day at a time. A day at a time.
Take it
A day at
one
a time.
day at a time. And don't be too anxious for anything and get too flustered what you can. Because my doctor was saying, but Miss Dawn, when you're going to worry, when you finish worrying out,
Yeah.
can you worry about something that you have no control
You have no
over?
control over. That's so true.
And you see, and
Just
when you
just try
sit,
to live a day at a
when
time.
you sit
yeah.
and worry, in what way that going to be helping
It's
you?
not going to help. It's not going to help.
So these are the
Yeah, we get with fuss and we get all the anxiety.
yes, yes,
But
yes.
it's not going to help. It will probably make the
because-
situation
yes,
worse.
but even then, when I have to be waiting for these 1 month, 2 months thing, and I
then
want it
know,
right
we're
away.
human,
And we want it
we're-
right away, but so there are times you say, look here, man, so.
Yeah.
So, as I said, my church group, okay, where did I go? Oh, I went to the doctor Friday,
right.
to my visit, and then I came home, I felt tired and I was lying down. A church brother called me and said, Miss Dawn, what you doing? Come on, we're going to a gospel concert. And I didn't have any plan, so I just said, sure, I'm coming.
That's right. That's right.
So,
of course, you have to have the
yeah,
get up and go
yeah,
attitude.
you
Yeah,
know,
you
yeah.
have
So,
to
yeah,
have the
so,
get up
yeah.
and go attitude.
So once, okay, I tell you what. You see, after I lost my job in COVID, because where I was working, it's a church I was working, and I was doing a tuck shop there. So I would sell snacks and stuff to the members because sometimes they will just leave work, leave school, and come to church, so they'll need something to eat. So that's what I was doing. So now, remember in COVID, church was closed down and not keeping for a period of time and so on. And church is not a place that raise for that, I just say offering, but then you have to pay workers, you have to pay light bill, you have to pay, whatever, and then you have to help other members who are sick. So church, limited funds. So at the time with me, with tuck shop not keeping and so
Right.
on, they couldn't keep me on staff.
Right.
So they made me redundant.
Oh.
They made me redundant.
Oh, wow. What a time to
Yes.
not have a job in.
Yes, yes.
But also at the
So
same
it
time.
was shortly after that I got diagnosed with this.
After
so
that. Oh,
yeah.
wow.
So when I told you that some of the tests in the earlier time, even with the PET scan, is from savings. It's like the redundancy money and whatever money I hadn't. Yes, I had to take it to go to the hotel and whatever. So yeah.
If you can assist Ms Dawn Blair, it would be nice. You know, and my advocacy is big when it comes on to advocating for financial assistance for our fighting sisters. I am pleased asking you if you can help in any way. This is Ms Dawn Blair, and you know she needs your support, and I would really appreciate it for her. Right, Ms Dawn Blair?
Yes, thanks much.
Yes,
Thanks
in
much.
any way.
Thanks much.
In any way.
So
Ms Dawn Blair, what would you say to someone who is fighting now, and especially with stage 4? What advice would you give to someone who's fighting stage 4 breast cancer? How can they stay as strong and positive as you?
As best as you can, surround yourself with the right people, or some positive persons, and any similar groups, even like Wish to Recovery,
right?
People who have had the experience, who have been through it, and who is going through it. That's a good group to
be a part of.
Because I came to the meeting one night, and they were saying bad news, and I was saying, I have bad news, because I've been diagnosed now and I have a spread and so on. They said it spread to my lungs. And your friend there, what's her name? She was telling me that, don't worry yourself, Ms Dawn, because me is living with one lungs.
Who is that, Georgia?
Not Georgia. It was her church we went to for the Sunday service.
Oh, Miss Latoya Jones. Yes.
So, so things like this. I said, Miss Dawn, don't worry yourself. Because me is living with one lung. So apparently hers, she had to. So, yeah.
So we have Latoya stories.
So these kind of support persons, yes, we wish we could block out the negative ones, but when you get that, sometimes it's not as easy to say that it run off like water off the duck box.
I don't think that they mean to be
Well,
negative.
that is true. That's true.
It's just that they don't know what to say. But if you don't know what to say, then don't say anything.
yes, that's true,
Don't say anything.
Because, okay, even with this bone thing, I don't know, because my hip, and I don't even know if it causes it, or if it's the old age thing, or arthritis, but my hip, especially this right here, sometimes it hurt. Right. It's like a continuous hurt where I can't sleep, it wake me up or so on. But there are times, and if and when it acts up, I tend to probably walk with a limp. I don't, And then when my neighbor, because I kind of live in a community, it's like about 7 or so houses in there. We don't dwell in, everybody had their own.
Right.
But so, this particular neighbor will see me and say, Miss Nana, walk me to you. You walk like your foot no good. At the time, I didn't say anything to her because I was rushing out. I was,
Right.
So when I come back, I said, Miss, you forget some is a sick somebody.
Right.
Not because whatever. So when you make those comments, it's not that I'm trying to draw attention to myself. If I'm just not feeling well.
Let me tell you something. People will look at me too and say, what are you get too fat? Are you too mager? And they don't understand that, hey, I am not 100% well.
Yes.
I am on medication
Yes.
that will steroids. I am on the bone treatment, which is zoltronic acid, which causes weight gain as well. And they don't understand that you are fighting a battle. You are fighting a battle.
So that's what I said to her. So I said, Miss, you forget that I'm not. So what you're saying, if you're not walking properly, you have to come out your house, you must just stay inside.
Yeah.
No, I have to do what I have to do.
Yes, you have to do what you have to do. And I like that. I like that. I like that.
So
like
yes, I'm just saying, sometimes they don't necessarily want to be bothered or to
They
hurt,
don't, yeah, but
some
yeah,
of the
but
things
sometimes,
that they said, man,
yeah.
you know, but I'm going on. I take it one day at a time.
Thank you very much for
And I thank you.
for doing this with me. Together we are spreading awareness and we're saving lives. Yes, yes. Thank you guys. Thanks for tuning in, and this episode was sponsored by D Right Prolific Olive, and we have a little token here in the envelope. Cash, you know, just a small token for Ms Dawn Blair, and this is from D Right Prolific Olive. Thank you very much, D Right, for gifting this to Ms Dawn.
Thank you, D Right. I appreciate it. Blessings upon you.
Right.
Thank you.
Right, so thank you again.
In a world of whispers, fears, I found strength through all my tears. Sharing stories through the night, hope will guide us to the light. In the dark we find